Hi, I'm Tony. Let's roll the short leg cast today. Short leg cast is a very common lower extremity cast that you will apply as an orthopedic technician. It is your basis for any lower extremity type cast. These are the materials you will need: a little bit of water, some gloves, because you should never touch anyone in a medical facility that you're unfamiliar with bare hands. You'll need your stockinette. You would need your cotton. I'm using 3-inch today. Also, you would need your fiberglass because without fiberglass, there is no cast. So you need your fiberglass or plaster, depending on the environment that you're in. A good pair of scissors so you can cut your materials. Also, optional, you would need felt. You would need foam liner. So in case you need to talk to your patients, communicate with them, ask them how they're getting around. Are they using crutches? Or are they using knee scooters? If they're using a knee scooter, a piece of felt along the tibial spine will help a lot because there is a lot of pressure that is being applied in that area when using knee scooters. So talk to your patients and use material accordingly. Once you begin your short leg cast, or even as soon as you get the patient on the set table, remember this could be their first time ever being injured. In turn, this injury could be very life-changing, life-altering for them. So try to communicate with the patient. Try to get them ease their mind just a little bit when you're positioning them. All right. As an orthopedic technician, you're gonna put this patient in a position that is neutral, 90 degrees, or you're gonna put them in a position as prescribed by the physician. I'm using a foot stand today. Basically just a metal stand to line up the patient's leg to get their ankles in a neutral position. I like to use the thigh, the knee joint, and the lateral malleolus to line up my patients to get them in a proper position. Also, I like the position to make sure that the knee of the patient is parallel or lined up with my center of my chest, so I can deem that we're both even with each other. Here, we always want to cut out the crease in the ankle. You always want to cut out because the stockinette will bunch up right at the crease of the ankle. Once you get your cotton, you always want, like every cast that you're going to ever do, always try to be 50-50 with the roll. That'll give, unless prescribed or told otherwise, based on the facility or the environment that you're currently working in, you always want to go 50-50 to get an even roll, even protection with the material. Once you got your cotton in, laid down smooth, you're going to get your first roll. You're going to dip it. You're going to start at the great toe, right at the sesamoid. That's the flat bone behind your great toe, if you ever feel the bottom of your foot. And again, follow the same path with my fiberglass, even 50-50, roll it up. Sometimes with short legs, depending on the patient and their size or how they're structured, you may have a patient with a very large calf. In turn, it will, depending on your fiberglass that you're using, depending on the brand, it may cause that fiberglass to try to buckle or wrinkle. So always try to keep your hands and be mindful of the angle that you're rolling. Okay? Do not be discouraged. Keep rolling. You got this. Constantly communicate with your patient. Check in with them. Make sure they're okay. Does this feel okay? How are you doing? Just check in with them. Patients love when you check in with them as you're working. Okay? Keep rubbing your material. I like to put a little extra cotton here on the edges. This is something you don't have to do as a technician. This is something that I do, something I've been doing for years. And that for me, it just keeps the edge of that fiberglass that's underneath the stockinette from being a sharp edge, because eventually at some point that cotton will mat itself down and could cause a little bit of discomfort. So for me, I put a little bit of extra cotton right on the edge before I tuck the edges with my stockinette, just to give it a little bit of cushion, a little bit of bump. And sometimes for me, aesthetically, it is pleasing. Once you tuck your stockinette down, always cut off your excess, because remember guys, we are going to use a cast saw that oscillates, that goes back and forth at a high rate of speed. basically uses friction to cut. If that stockinette is too far down inside of that cast, I promise you that cast removal will be more difficult than you need. Now I'm picking cotton off my fingers. Normally I would use a double glove technique, and that's just so I can just get one glove to get the base layer on, and then once I get to the color layer of the cast, I can just remove one. But in this environment, this is for training. I didn't do it this go around, but I will remember next time. Now we're here with the color roll, and all I'm doing is just following the path that I followed with the cotton. I followed the path with the white layer. I'm going around. I am filling the cast. Pay attention to my hands. My hands, both hands, are always in constant motion. They're meeting each other as I wrap around this extremity. And just constantly just keep rolling. Talk to your patients, communicate, check in with them. Sometimes just talking to these patients after having these sometimes traumatic moments, these injuries, makes a world of difference for them in their healing process. I always believe that if your mind is positive, your body will heal. If your mind is negative, your body will react and may not heal as well versus you being positive. Now, get some water on your hands, and now you want to try to remove them from the foot stand. In this case, the patient's foot was sticking. If you find yourself and the patient's foot is sticking to the foot stand, try to let the material dry a little bit more, because if you remove that foot stand while that patient is sticking, it is a strong chance you can cause that cast to buckle, especially in the back and the Achilles area. And like I always say as an orthopedic technician, you want to rub it how you love it. But while I'm rubbing, as you see, I am maintaining my hands. I'm creating a little bit of upward force to keep that patient in a neutral position. Because sometimes if your material is still drying and you let that patient drop, they will drop in a plantar flex position. In turn, you will end up with a crease in the Achilles. In turn, that can cause a pressure point. In turn, you can have more injury to the patient than needed. All right, check in, make sure you got them at neutral. Keep rubbing, keep checking in. Let them know that you're done. At this point, the cast is actually complete. This cast can potentially be done in less than 10 minutes after you've done a few. Very easy, very standard, routine cast for all types of orthopedic situations. You remove your glove, you get out of there. Thank you guys for watching. My name is Tony. Until next cast.